You know, there's a health issue out there affecting nearly 1 in every 3 adults on the planet. And the crazy part is, most of them don't even know they have it. It works in the shadows, totally silent, maybe just making you feel a little tired. But left unchecked, it can lead to some really serious, irreversible liver damage. So today, we are going to pull back the curtain on this silent epidemic. We'll talk about what it is, how you find out if you have it, and, this is the most important part, how you can turn it around. So, let's start with something that just happened, something that really gets to the core of this whole thing. Just last year, the world's most common chronic liver condition got a brand new name. And trust me, this wasn't just some marketing gimmick. The change was made for a very specific reason, to completely reshape how we think about our liver health and what's really causing the problem in the first place. And here it is. Meet MASLD. It stands for Metabolic Dysfunction Associated Steatotic Liver Disease. Yeah, I know, it's a mouthful, but every single one of those words is there for a reason. It's the new name for what we used to call NAFLD, or non-alcoholic fatty liver disease. And here's the crucial shift. The new name creates a direct, can't-ignore-it link between having extra fat in your liver and your overall metabolic health. Things like your blood sugar, your cholesterol, your body weight. It gets rid of the old confusion and makes it crystal clear. This is a metabolic problem, period. It has nothing to do with alcohol. And the sheer scale of this, it's just staggering. We're talking about an estimated 30% of all adults in the world. Just think about that for a second. That means roughly 1 in 3 people are walking around with an organ that is quietly building up fat, setting the stage for serious inflammation and scarring down the road. You know, the really dangerous thing about MASLD is how sneaky it is. It almost never sends up a big red flag. I mean, think about someone like Seema, a busy 37-year-old teacher. Her only real complaint was just feeling wiped out all the time, maybe a little bloated. That's a feeling millions of us can relate to, right? And for so many, that nagging fatigue is the only clue that their liver is under some serious stress. All right, so this all leads to the big question, the one you're probably asking yourself right now. Could this be me? Because this thing is so common and so quiet, just understanding the risk factors is one of the most powerful things you can do for your health in the long run. So how can you know if you're someone who should be paying extra attention to this? Well, the great thing about the new MASLD definition is that it makes it incredibly simple. It basically lays out a clear checklist of metabolic red flags. Let's take a look. Okay, now what's so important about this slide is the new rule for getting a diagnosis. To be diagnosed with MASLD, you need to have fat in your liver, which a doctor can see on a scan, plus just only one of these 5 cardiometabolic risk factors. That's it. That's the bar. So whether it's having prediabetes, or carrying a little extra weight around your middle, or having blood pressure that's creeping up, any single one of these, when paired with a fatty liver, is enough. And it doesn't stop with those metabolic markers. The research also shows that our age and hormones can play a big part too. Specifically, men over 50 and women who are postmenopausal seem to have a higher risk, not just of getting the disease, but of it progressing into those more serious stages with inflammation and scarring. All right, so if any of those risk factors we just talked about sounded a little too familiar, the next question is obvious. How do you find out for sure? Well, here is some fantastic news. The way we diagnose this has been completely revolutionized. It's now faster, it's way simpler, and it's so much less intimidating than it used to be. The newest clinical guidelines lay out this really clear 3-step process. First, it starts simply by identifying if you have any of those risk factors we just went over. If the answer is yes, the next step isn't some crazy procedure. It's a simple calculation using your regular blood work. And only if that raises a flag do you move on to the 3rd step, which is just a quick, painless scan. This is a perfect illustration of that 2nd step. It's called the 5-4 index. And no, it's not some special, expensive test you have to ask for. It's just a clever formula that uses 4 things your doctor probably already has from your blood tests: your age, a couple of common liver enzymes, and your platelet count. They can plug these numbers into a calculator, and poof, it gives you a score that puts your risk for liver scarring or fibrosis into a low, medium, or high bucket. It's an incredibly powerful first line of defense that's easy for everyone to access. And what if that FIB4 score comes back in that intermediate or high-risk zone? Well, just look at the unbelievable leap forward we've made. For years, the only way to know for sure was a liver biopsy. Yeah, a painful procedure with a long needle. Today, the go-to tool is something called a fibroscan. It's basically a special ultrasound for your liver that uses sound waves to check how stiff it is. The whole thing takes maybe 5 minutes, it's totally painless, and it gives you critical information right then and there. What a difference.
Okay, now we get to the absolute best part of this entire conversation, the most empowering part. Getting a mast cell diagnosis is not a life sentence, not even close. In fact, for most people, this is a completely reversible condition, and you are in the driver's seat.
This quote right here really says it all. Your liver is an amazing organ. It has this incredible built-in capacity to heal itself. Once you take away the metabolic stress it's been under, it can, and it really wants to, get better. With the right game plan, you can actually reduce the fat, cool off the inflammation, and stop the damage right in its tracks.
So what does it actually take? What kind of effort are we talking about? Well, the science on this is unbelievably clear and so encouraging. Just losing 5% of your body weight can cause a huge drop in the amount of fat in your liver. For someone who weighs 200 pounds, that's just 10 pounds. That's a totally doable goal, and it pays massive dividends for your liver. Now let's take it a step further. What if you can push that weight loss to somewhere between 7 and 10%? The benefits get even bigger. This is the sweet spot where studies show you can actually start to resolve steatohepatitis. That's the dangerous inflammation that really drives the damage. At this point, you're not just getting rid of fat, you're actively putting out the fire.
And this is the real game changer. For people who can achieve a weight loss of 10% or more, the science is clear. It is possible to see actual improvement and even reversal of the fibrosis itself, the scar tissue. It shows a direct link. The more progress you make with your weight, the more your liver heals. It's that simple.
So the big question is, how do you do it? Well, the official guidelines recommend a simple but really powerful lifestyle toolkit. First, try shifting your diet to be more Mediterranean style, full of vegetables, healthy fats, lean protein. Second, and this is a big one, be ruthless about cutting out sugary drinks and ultra-processed junk foods. Third, get moving. Aim for at least 150 minutes of moderate exercise, like a brisk walk, every single week. And finally, even though alcohol doesn't cause this, cutting back gives your liver the best possible chance to heal. But what if the disease is a bit more advanced? Or what happens when you're doing all the right things with diet and exercise, but it's just not enough to get the results you need? Well, for the first time ever, we now have some powerful medical options to give you that extra support.
And honestly, this is a complete game changer. What it means is that for people who have more significant liver damage, there's now a clear path forward. Lifestyle is still and will always be the foundation of treatment, but now it can be combined with really targeted therapies to help stop and even reverse the disease.
So let's take a quick look at this modern medical toolkit. First, in a huge breakthrough, a drug called resmetirom recently became the very first medication approved specifically to treat MASH with fibrosis. Then you have the newer diabetes and weight loss drugs, like the GLP-1s, which have shown amazing benefits for the liver because they tackle the root metabolic problems. And finally, for patients who are eligible, bariatric surgery is still one of the most effective tools we have to get that significant, lasting weight loss that can truly reverse major liver damage.
And at the end of the day, this is the main takeaway. Whether you do it through lifestyle or with the help of medication or surgery, the power to change the future of this disease is more and more in your own hands. You have a real choice to make, a real chance to protect and heal this incredibly important organ.
So, we'll leave you with this question to think about. Knowing that your liver has this amazing, natural ability to heal itself, and knowing that there's a clear roadmap to help it do just that. What's the first small step you can take? Maybe it's as simple as swapping one soda for a glass of water today. Maybe it's scheduling a 20-minute walk. Or maybe, and this is the most important one, it's making a call to talk about this with your doctor. And as always, just a crucial reminder, all the information we talked about today is for educational purposes. It is absolutely not a substitute for professional medical advice. Please make sure you talk with a qualified healthcare provider to discuss your personal health before you start any new treatment or make any big changes to your lifestyle.
Thank you for being here with me today. Remember, small choices create big changes. Keep nourishing your health with love and consistency. See you in the next Vital Elixir video.